Hi everyone, so now I will discuss all about dyslipidemia. So first, what is dyslipidemia? So dyslipidemia is the abnormal amount of lipid in the blood. So it includes triglyceride, phospholipid, fats, and cholesterol. And dyslipidemia is the elevation of lipids in the blood, and it includes a disease called hyperlipidemia. Lipids or lipoproteins are fats that we found circulating in the bloodstream. It includes low density lipoproteins, high density lipoproteins, and triglycerides. And the LDL or the bad cholesterol can contribute to the formation of plaque buildup in the arteries, which is known as atherosclerosis. So it helps increase the risk of heart attack and stroke. While the HDL, or also known as good cholesterol, helps to remove cholesterol in the blood. Elevated hyperlipidemia or cholesterol may be due to two life factors. First is the lack of exercise. Second is the diet containing excess saturated fats. It could be also from inherited defect of lipoprotein metabolism, or most commonly it is from a combination of both genetic and lifestyle factors. Appropriate lifestyle changes along with drug therapies can lead to 30 to 40% reduction of coronary heart disease mortality. While the elevated triglycerides level may be due to medical conditions such as diabetes, hypothyroidism, liver disease, and kidney disease, while the dietary causes may be due to increased alcohol intake, foods containing saturated fats, cholesterol, and trans fats. In hyperlipidemia, there are two treatment strategies. First is the diet, second is drug. So in diet, cholesterol and saturated fats are two primary dietary factors that contribute to the elevation of plasma lipoprotein. Second is in drugs. In each patient, the choice of drug depends on the lipid abnormalities, and the drugs that are effective in lowering LDL cholesterols are statins, fibrates, bile acid sequestrants, um, sterols, absorption inhibitors, and niacin. Here are examples of lipid-lowering drugs that we will tackle. Lovastatin and simvastatins are lactones hydrolyzed to active drugs, and the remaining statins are administered into their active form. And the absorption of statins is variable 30% to 85% following oral administration.
In the first step of mechanism of action of statins, it shows that statins inhibit hydroxymethylglutaryl coenzyme reductase, which leads to decreased concentration of cholesterol within the cell. And in the second step, we could observe that the low intracellular cholesterol stimulates the synthesis of LDL receptors. And while in the third step, we could see that there is an increased number of LDL receptors, which leads to the promotion of uptake of LDL from blood. And in the last step, the low intracellular cholesterol decreases the secretion of the VLDL. In overall, the mechanism of action of statins shows the inhibition of hydroxymethylglutaryl coenzyme.
Statins reduce the LDL cholesterol levels dramatically, especially in a combination of other cholesterol-lowering drugs. So they are used commonly because they are effective and well tolerated. So statins reduce the coronary events and mortality for patients who have ischemic heart disease. And statins also reduce the risk of ischemic stroke. Statins also reduces triglycerides level and increases the HDL cholesterol level. Statins are effective in lowering plasma cholesterol levels in all types of hyperlipidemias. However, patients who are homozygous for familial hypercholesterolemia lack LDL receptors and therefore benefit much less from the treatment with this drug. Mild elevation of serum aminotransferase are more common but are not often associated with hepatic damage. And for those patients who have pre-existing liver diseases, so they feel or experience more severe reactions. And when there is an increase in creatinine kinase, it is noted that it is about 10% in patient if you feel severe muscle pain and rhabdomyolysis may occur. Drugs or foods that inhibits the cytochrome 450 activity will increase the risk of hepatotoxicity and myopathy. So example of this is the grapefruit juice. And as there is an evidence that the hydroxymethylglutaryl coenzyme reductase inhibitors are teratogenic, so this drug must be avoided for those who are pregnant. Gemfibrozil and fenofibrate are completely absorbed after oral administration, distribute widely, and bound to albumin. Fenofibrate is a prodrug which is converted into an active moiety fenofibric acid. So both drugs undergo expensive biotransformation and excreted in urine as glucuronide conjugates.
In the mechanism of action of fibrates, it shows that fibrates stimulate cellular fatty acid uptake in the conversion to acyl-CoA derivatives and catabolism by the beta-oxidation pathways, which combined with a reduction in fatty acid and triglyceride synthesis. In a result, there is a decrease in VLDL production.
Gemfibrozil and fenofibrate are used to treat hypertriglyceridemia, as these drugs has only a modest ability to reduce LDL cholesterol level and can also increase LDL cholesterol level in some patients, and they're often combined with other cholesterol lowering drug for the treatment of patients who have elevated concentrations of LDL or VLDL, or also known as very low density lipoproteins. Fibrates are used for the treatments of hypertriglycerides, and it is also useful for treating type 3 hyperlipidemia, in which the intermediate density lipoprotein particles accumulates. Nausea is the most common side effect of fibric acid, while skin rashes are the most common side effect of gemfibrozil. And some patients shows a decrease in white blood count or hematocrit, as this drug potentiate the action of anticoagulant. Bile acid sequestrants are insoluble in water as they have large molecular weight, and after oral administration, they are neither absorbed or metabolically altered by the intestine, but instead they are totally excreted in the feces.
In the mechanism of action of bile acid sequestrants, anion exchange resins bind bile acids in the intestine, forming a complex where there is a loss of bile acids in the stools and there is an increased conversion of cholesterol into bile acids in the liver. In the decreased concentration of intrahepatic cholesterol, it leads to compensatory increase in LDL receptors, and there is also an increased hepatic uptake of circulating LDL, while there is a decreased serum LDL cholesterol levels.
It is used for patients who have hypercholesterolemia, and it is also used to reduce pruritus for patients who have cholestasis and bile salt accumulation. Bile acid sequestrants are useful in treating type 2A and type 2B hyperlipidemias, and which are often in combination of diet or niacin. And cholestyramine can also be used to relieve pruritus, which is caused by the accumulation of the bile acids. The common adverse effects are GI disturbance, constipation, nausea, and flatulence. So these agents most commonly raises triglycerides levels and contraindicated in patients with significant hypertriglyceridemia. Ezetimibe is the first lipid-lowering drugs that inhibits intestinal uptake of dietary and biliary cholesterol without affecting the absorption of the fat-soluble nutrients. Following oral administration, ezetimibe is rapidly absorbed and extensively metabolized to the pharmacologically active ezetimibe glucuronide. Ezetimibe is used for the treatment of hypercholesterolemia, and it is also used for the treatment of phytosterolemia, which is a rare genetic disorder which is a result from impaired export of phytosterols. Ezetimibe lowers the low-density lipoprotein cholesterol to 15 to 20% when used alone, compared to the 5 to 10%, doubling the dose of statins. Ezetimibe has shown to reduce the level of total cholesterols. Next is the low-density lipoprotein cholesterols. Next is the apoprotein B. Next is the non-high-density lipoprotein cholesterols and triglycerides. It also shows some increase in high-density lipoprotein cholesterols for patients who have hyperlipidemia. Ezetimibe is well tolerated, but when in combination with hydroxymethylglutaryl coenzyme reductase, it may increase the risk of hepatic toxicity, and in dose-dependent, nausea and abdominal discomfort often occurs, and pruritus and other skin conditions are also reported. There is a moderate elevation of liver enzymes, and even severe hepatotoxicity may occur, and in severe liver dysfunction, it has been associated with excess release of preparation, which is not the same as the sustained release formulation. Hyperuricemia may occur about 20% in patient, and the carbohydrate tolerance may be moderately impaired. Niacin is administered orally. It is converted by the body into a nicotinamides, which is incorporated with the cofactor nicotinamide adenine dinucleotide. So, niacin and its nicotinamide derivatives and other metabolites are excreted into the urine. But always remember that administration of nicotinamide alone could not decrease the plasma lipid levels.
In the mechanism of action of nicotinic acid, niacin inhibits VLDL secretion from the liver, thus concomitantly decreasing circulating LDL and hence increases HDL. It is converted in the body to nicotinamide and excreted in urine as nicotinamide. So nicotinamide has no anti-hyperlipidemic activity, yet it retains its vitamin psychologic activity.
Niacin lowers serum LDL cholesterol and triglycerides concentration, but it increases the HDL cholesterol concentrations. So niacin has a wide clinical usefulness as it is used for the treatment of hypercholesterolemia, hypertriglyceridemia, and for low HDL cholesterol. Niacin lowers plasma level of both cholesterols and triglycerides. Therefore, it is useful in the treatment of familial hyperlipidemias, and it could also be used for the treatment of severe hypercholesterolemias and often of combination with other agents. The most common adverse effect of niacin are intense continuous flush, which is accompanied by uncomfortable feeling of warmth and pruritus. Niacin inhibits the tubular secretion of uric acid, and thus predisposes patients into hyperuricemia and gout, and impaired glucose tolerance and hepatotoxicity have also been reported. And this drug must be avoided for those who have active hepatic diseases and for those patients who have peptic ulcer. And that's all for my topic, and I hope you learned something new. And for any clarifications and questions, you can directly message me and I will answer all of it. So that's all. Thank you. God bless and keep safe.